Welcome back, future lifesavers. We've reached the grand finale of our EMT course. Today we're pulling out all the stops for a comprehensive review that'll knock your socks off. Our dynamic duo, Zeke and Anya, are here to guide us through this knowledge extravaganza. So grab your stethoscopes and strap in.
Good morning, heroes in the making. This is Captain Dave coming at you on First Responder Radio. Today's forecast calls for a 100% chance of life-saving knowledge with a high probability of excellence. That's right, folks. We're about to get our biggest lesson of EMT knowledge. So listen up, because this information might just save a life one day, maybe even your own.
All right, let's kick things off with the basics. What are the different levels of EMT certification?
We've got 3 main levels: EMT Basic, Advanced EMT, and Paramedic. Each level is like leveling up in a video game. You gain more skills and can perform more advanced interventions.
Can you give us an example of what each level can do?
An EMT Basic might be able to perform CPR and use an AED, and an Advanced EMT could start IVs and administer some medications. A Paramedic, now they're the boss level, they can perform advanced airway management, interpret ECGs, and even perform some surgical procedures in the field.
Now, what types of exams do EMTs need to pass for certification?
We've got 2 main hurdles to clear: written and practical exams. The written test is like a marathon for your brain, testing your knowledge on everything from anatomy to emergency procedures. The practical exam, on the other hand, is where the rubber meets the road. You've got to show you can actually perform life-saving techniques under pressure.
Speaking of exams, what are some effective test-taking techniques?
Oh, I've got a few tricks up my sleeve. First, time management is key. Treat the exam like a patient with a critical condition. You need to work efficiently. Reading comprehension is crucial. Sometimes the question is hiding vital info, just like a patient might hide symptoms. Use the process of elimination. If you're not sure, cross out what you know is wrong. And always trust your gut. Your first instinct is often right, just like in the field.
Great tips. Now, let's dive into patient care. What vital signs should EMTs regularly monitor?
The holy trinity of vital signs: alert, pulse, respiration, and blood pressure. These are like the speedometer, tachometer, and fuel gauge of the human body. They give us crucial info about a patient's conditioning.
Can you give us a real-life example of how these vital signs might change in an emergency?
Absolutely. Picture this. You're called to a scene where a jogger has collapsed. When you arrive, you find their pulse is rapid and weak, respirations are fast and shallow, and blood pressure is low. This combination of vital signs screams shock, maybe from severe dehydration or even internal bleeding. It's a red alert that this patient needs immediate intervention and rapid transport.
Excellent example. Now, let's talk about airway management. What are some key techniques?
We have techniques like the head tilt, chin lift, and jaw thrust maneuvers to open the airway. Then we've got tools like oropharyngeal and nasopharyngeal airways. I like to think of these as snorkels for the unconscious.
Can you walk us through a scenario where you'd use these techniques?
Sure thing. Imagine you're called to a pool party where a teenager has been found unconscious at the bottom of the pool. After getting them out of the water, you'd first use the jaw thrust maneuver to open the airway without moving the neck in case of a spinal injury. If they're not breathing, you might insert an oropharyngeal airway to keep the tongue from blocking the airway while you start rescue breathing.
Now, let's move on to trauma care. How should bleeding be controlled in an emergency?
The art of stopping the red stuff. We've got a few tricks up our sleeve. First and foremost, direct pressure is our go-to move. It's like giving a bear hug to the wound. If that's not cutting it, we escalate to bandaging, which is like wrapping a present, except the gift is stopping blood loss. And if things get really dicey, we bring out the big guns, tourniquets. But remember, tourniquets are a last resort, like using your emergency parachute while skydiving.
Can you walk us through a real-life scenario where you might use these techniques?
Picture this. You're called to a construction site where a worker has suffered a deep laceration to their forearm from a power saw. You arrive to find bright red blood pulsing from the wound. That's arterial bleeding, folks, and it's bad news. You'd start with direct pressure using a sterile dressing if available, or the cleanest cloth you can find if not. If the bleeding doesn't stop, you'd apply a pressure bandage. If that still doesn't work and you're seeing signs of shock, it's tourniquet time. Apply it above the elbow, mark the time, and get that patient to the hospital ASAP.
Now, speaking of shock, can you tell us more about it?
Shock is like the body's way of sounding the alarm. It's saying, hey, something's seriously wrong here. Signs include pale or clammy skin, rapid pulse, and confusion. It's like the body's trying to phone a friend, but all the lines are busy. We manage it with fluid resuscitation to keep the blood flowing, maintaining body temperature because shock makes you feel chilly, and rapid transport because time is tissue, my friends.
Great explanation. Let's shift gears to cardiac emergencies. What's the function of an AID?
An AED, or automated external defibrillator, is like a reset button for the heart. It analyzes the heart's rhythm and delivers a shock if needed to restore normal cardiac rhythm. Think of it as a defibrillator with training wheels. It tells you exactly what to do and when to do it.
And what are the steps in CPR?
CPR is like a choreographed dance to save a life. First, you check for responsiveness. Give them a shake and a shout. If there's no response, it's showtime. Call for help, then start chest compressions. Push hard and fast in the center of the chest, about 120 times per minute. Think of the beat to Stayin' Alive by the Bee Gees, ironically perfect for CPR. After 30 compressions, give 2 rescue breaths, then back to compressions. If an AED arrives, use it immediately.
Now, let's talk about something equally important, but often overlooked: communication. Why is effective communication so crucial in EMS?
Communication in EMS is like being a translator, a diplomat, and a storyteller all rolled into one. It ensures clear and concise information exchange with patients, family members, and healthcare providers. Good communication can make all the difference between a smooth, effective response and a chaotic one. For example, imagine you're responding to a call for a patient with chest pain. Effective communication with the patient helps you gather accurate information about their symptoms and medical history. Clear communication with your partner ensures you're working as a team, not stepping on each other's toes. And when you hand off to the ER staff, concise communication ensures they have all the vital info to continue care seamlessly.
Excellent point. Now, let's talk about something equally important: empathy. Why is empathy crucial in patient care and team coordination?
Empathy, the secret sauce of great patient care. It's like being an emotional detective. You're not just treating symptoms, you're connecting with a person who's often scared, in pain, or confused. Empathy helps us understand and respond to the emotional needs of our patients, which can be just as important as their physical needs. For instance, imagine you're treating a child with a broken arm. Sure, you need to stabilize the fracture, but you also need to calm their fears and maybe even distract them from the pain. That's where empathy shines. In team coordination, empathy is like being a mind reader. It helps you anticipate your partner's needs before they even ask. It creates a supportive environment where everyone feels valued and understood.
Great explanation. Now, let's shift gears to legal and ethical considerations. Why are these important in EMS?
Legal and ethical considerations are like the guardrails of our profession. They keep us on the right path and protect both us and our patients. Understanding these helps us maintain patient confidentiality, adhere to professional conduct, and work within our scope of practice. For example, let's say you arrive at a scene and find a patient who's intoxicated but refusing treatment. Legally and ethically, you need to assess their capacity to refuse care, document thoroughly, and potentially involve medical control or law enforcement if there's a risk to the patient or others. It's a delicate balance between respecting patient autonomy and ensuring their safety.
How can EMTs ensure ethical practice?
Ensuring ethical practice is like being your own personal Jiminy Cricket, always letting your conscience be your guide. It's about doing the right thing even when no one's watching. This means following legal guidelines and ethical principles in every aspect of patient care. And for instance, maintaining patient confidentiality isn't just about not gossiping about cases. It's about being mindful of how you discuss cases for educational purposes, ensuring patient privacy in the back of the ambulance, and being careful about what you post on social media. It also means being honest in your documentation, even if you made a mistake. Owning up to errors and learning from them is a crucial part of ethical practice.
Now, for our final topic, why is continuous learning so important in EMS?
Continuous learning in EMS is like sharpening your sword before every battle. Our field is always advancing, new techniques, new equipment, new protocols. If we don't keep up, we're not just falling behind, we're potentially putting our patients at risk. For example, think about how CPR guidelines have changed over the years. If you learned CPR a decade ago and never updated your knowledge, you'd be doing it wrong today. Continuous learning ensures we're always providing the best possible care based on the latest evidence and best practices. Plus, let's face it, our job is never routine. One day you might be delivering a baby, the next you're managing a multi-car pileup. Continuous learning helps us stay prepared for anything that comes our way.
This comprehensive review highlights the incredible breadth and depth of knowledge required to be an effective EMT. It's clear that being an EMT is not just about memorizing facts, but about applying that knowledge in high-pressure situations to save lives.
And it's impressive how Zeke and Anya emphasize the importance of both technical skills and soft.
It's clear that being an effective EMT requires a unique blend of medical knowledge, practical skills, and interpersonal abilities. Now let's wrap up with some final thoughts for our listeners.
Zeke, Anya, any parting words of wisdom for our future EMTs out there?
Remember folks, being an EMT is like being a superhero without the cape. You will face challenges that will test you physically, mentally, and emotionally. But the rewards, they're immeasurable.
I'd add that continuous learning is your superpower. The field of emergency medicine is always evolving, so stay curious and never stop improving your skills.
Exactly. And don't forget the importance of self-care. This job can be stressful, so make sure you're taking care of yourself too. You can't pour from an empty cup after all.
Great point. Lastly, I'd say to our listeners, trust your training. When you're out there in the field, you might face situations that seem overwhelming. But remember, you've been prepared for this. Trust your knowledge, trust your skills, and trust your team.
Excellent advice, both of you. Now for our listeners, here's your final assignment. Create a comprehensive study plan for your EMT certification exam. Include review of textbooks, online resources, and practice tests. Set up study groups with your classmates, and don't forget to practice your hands-on skills in simulation labs.
Great idea. And remember folks, those mock exams and feedback sessions are invaluable for identifying your strengths and areas for improvement.
Dave, you're going to want your window lowered. I may have just released a spot of gas. I do apologize, as last night's dinner was bread heavy if you didn't notice already. And to all our future EMTs out there, here are some final tips.
1. Familiarize yourself with the prerequisites, examination requirements, and continuing education criteria for EMT certification.
2. Use a variety of study strategies, including textbooks, online resources, study groups, and practice tests.
3. Practice your practical skills regularly, especially CPR, trauma management, and medication administration.
4. Don't neglect your physical and mental health. Use relaxation techniques to manage exam stress.
5. Always prioritize patient safety and confidentiality in your practice.
6. And stay up to date with the latest EMS protocols and best practices through continuous education.
Excellent summary. Any last words for our listeners?
Yes, remember this. Being an EMT is more than just a job. It's a calling. You'll face challenges, but you'll also have the opportunity to make a real difference in people's lives every single day. Stay committed, stay compassionate, and never stop learning. The lives you save and the people you help will make it all worthwhile.
And every call is an opportunity to learn and grow. Even the most experienced EMTs encounter new situations. Embrace the challenges, learn from your mistakes, and celebrate your successes.
Absolutely. And don't forget the power of teamwork. EMS is a collaborative field. Build strong relationships with your partners, other first responders, and hospital staff. Together, you'll provide the best possible care for your patients.
Thank you all for joining us throughout this course. We wish you the best of luck in your EMT journey. Until next time, stay safe, stay prepared, and keep saving lives.
And that's a wrap, folks. This is Captain Dave, signing off from First Responder Radio. Remember, in emergencies, every second counts. And now you're prepared to make those seconds count.